Hello, I'm Anna, and today I'm going to present you my master thesis on the clinical integration of a novel haptic tool into a robotic-assisted surgery system. So, over the last few decades, surgery has evolved from open procedures to minimal invasive techniques like laparoscopy and robotic surgery, improving patient care. Laparoscopy, which uses small incisions and camera, reduces pain and recovery times but presents challenges such as limited dexterity of instruments. Robotic surgery addresses this, providing greater precision, better dexterity, and 3D visualization with systems like the Da Vinci or the Hugo system from Medtronic. However, a critical limitation remains for robotic surgery, the lack of haptic feedback, which is crucial for surgeons to feel tissue characteristics and identify structures like tumor margins. To validate and gain more insight on this need, I conducted interviews with surgeons who confirmed that while with traditional laparoscopy they have learned to identify indirect sensations through instruments, this is not possible in robotic surgery as surgeons are completely disconnected from the instruments, preventing them from this vital sense. This is where the PALPABLE project comes in. PALPABLE, a Horizon Europe consortium of 10 partners across 7 countries, aims to develop an advanced tool incorporating sensing technologies such as tactile sensors and pneumatic actuators to enhance tissue characterization in traditional laparoscopy. In this context, my master thesis takes this innovation a step further by focusing on the integration of PALPABLE into a robotic system, specifically Medtronic's Hugo system, which currently lacks haptic feedback, therefore allowing mutual benefits. On the one hand, expanding PALPABLE's applications by beyond traditional laparoscopy, and on the other hand, enhancing Hugo competitiveness by adding a valuable new feature. Starting this project required me very close collaboration with healthcare professionals like surgeons and Hugo training manager. Their invaluable insight into surgical workflows enabled me to identify 2 potential integration options for PALPABLE. Either a permanent integration in which PALPABLE would always be on a robotic arm, or a removable integration in which PALPABLE would be attached for haptic feedback and removed when not needed. So after extensive discussions with PALPABLE's technical experts and personally attending a laparoscopic surgery to gain first-hand insights, the permanent integration option had to be discarded due to technical and practical challenges. However, after speaking directly with surgeons and reviewing the scientific literature, I was able to confirm that the removable integration was the best option to fit with their current practices. Once I had validated the modality, I dove into the next step, identifying the technical requirements for the integration. So first of all, I had to determine the best method to connect PALPABLE to Hugo's robotic arms. Then I needed a communication interface to ensure surgeons can easily interact with PALPABLE for adjusting its flexibility. And finally, I had to identify the optimal placement of PALPABLE's external components within the OR. So regarding the first matter, after I analyzed the current attachment mechanism of Hugo, I proposed using the adapter used for Hugo's endoscope for integrating PALPABLE. This approach not only would it reduce costs, but it would also ensure seamless compatibility. Moreover, to further guide this attachment process, I developed a design prototype for PALPABLE's probe end to ensure a perfect fit with the adapter. Next, to determine the best fitted communication interface, I engaged in large discussions with surgeons and technical experts. Thanks to this collaboration, voice control emerged as the most feasible option. And as a first approach, I proposed a plan for the theoretical implementation of a voice control system in an operating room. Finally, for the optimal placement in the OR, I reached out to a hospital architect at Medtronic to learn about the specific requirements of the OR. After carefully analyzing the setup, I concluded that the real-time monitoring screen should be positioned near the surgeon's console and that the processing unit should be placed behind the console to be close to power sources and avoid tripping hazards. In conclusion, with this project, I address a critical gap in robotic-assisted surgery by reintroducing the sense of touch. the framework I developed could be adapted to other surgical systems, making procedures safer and more precise, ultimately leading to better health outcomes. Thank you very much.